Thank you, Dr. Sonia Begum, for introducing me. Assalamu alaikum and a very good morning to you all. I am Dr. Tasneem Hossain from National Institute of Cancer Research and Hospital, Dhaka. Today, I will take you through the story of women in oncology in Bangladesh, our challenges, resilience, and hope for more equitable future. Let's begin where we stand. Bangladesh faces increasing cancer burden with breast and cervical cancer as leading causes in women. On the other hand, in oncology workforce, female representation is somewhat limited. According to the paper on cancer education and training in SAARC countries led by Professor Saiful Haq sir, there are 250 radiation oncologists, 22 medical oncologists, 47 pediatric oncologists. But gender disaggregated data are limited, if not absent. So there is a huge female cancer burden on one hand and a limited representation of female in oncology on the other hand. That's what motivated the study, to capture women oncologists' perspective, to understand what opportunities they see, what barriers hold them back, and what lessons from around the world can guide us forward. Objective of the study were fourfold: to assess female representation and opportunities, to identify the social and professional barriers, to identify the needs and interventions required the most, and to highlight adaptable international models of gender-inclusive oncology. A descriptive cross-sectional study was carried out in July 2025 using a structured online questionnaire distributed among female oncologists and trainees nationwide using social media networks. A total of 51 respondents representing different subspecialties and institutions. The responses provided valuable qualitative and quantitative insight into the professional realities of women in oncology in Bangladesh. Among the respondents, 80.4% were below the age of 40 years, and work experience-wise, 75% respondents fall within 4 to 10 years range, representing a younger generation of women in the discipline. 68.6% were from radiation and clinical oncology, while respondents from medical oncology, surgical oncology, gyne-oncology, pediatric and hemato-oncology also participated. 84.3% of the respondents are working in Dhaka, 47% are from public institutes, and 25% work in institutes where research is held out. More of the quarter of respondents received training at NICRH, and only a few of them training from abroad, like Singapore, Tata Memorial, India. 39% of women responded that they faced barrier in entering oncology training. Most notable of them was limitation of seats, other were financial constraints and social barriers. However, most of the respondents find inadequate fellowship or subspecialty facilities or research opportunities after completing post-graduation. Long-term fellowship was received by only 5 out of the 51 respondents. 39% of women in the study never participated in international training or conference, and the greatest barriers identified was lack of funding in 62%. And institutional or government restrictions in around 40% of the respondents. While comparing to their male colleagues regarding equal opportunities for promotion and leadership, 29.4% agree and 29% disagree, while 27.5% remained neutral. Although only 17% and 21% of the respondents have led a leadership role in institution or research, respectively. One of the reasons for this was most of the respondents were below 40 years of age. 52.9% respondents believe there is barrier in leadership role. Among the contributing factors, most notable reason was limited leadership training, limited opportunities, gender bias, lack of mentorship, and familial expectations. When we asked about the biggest challenges as women oncologists in Bangladesh, 54% responded to balancing family responsibilities as prime reason. 51% response both in lack of mentorship and support network and resource limitations. Among other notable response was limited training opportunities and work-life balance. Regarding female health advocacy, 78% were found to be active in awareness and screening programs, and 58.8% believe women patients prefer to be treated by female oncologists. Regarding global awareness, 51% are aware of Global Oncology Network or leadership programs, but only 9.8% are part of international women oncology networks. However, 88% are interested in global mentorship and collaborative approaches. Urged to the policymakers. 60% respondents asked for work-life balance, policies like child daycare, and flexibility in work time. Scholarship and fellowship programs suggested by 52% of the respondents. It suggests that the struggle is not single-phased, rather multidimensional, layered across professional, social, and personal levels. Many respondents reported empathy towards cancer patients and intellectual interest motivated them to enter oncology as career, but only few, less than 20%, have professional mentors. Respondents feel opportunities can be flourished by professional development steps, societal supports, and reforming institutional policies. The next step to the study is to broaden the effort across disciplines and serve countries, combining quantitative mapping and qualitative interviews. We can measure the impact of pilot programs, leadership workshops, mentorship networks, and fellowship opportunities, and build evidence for long-term policy change. A few slides on global perspective. According to a paper published in the Journal of Clinical Oncology last year, it was shown that the growth of female radiation oncologists was 1.7% in Bangladesh, in contrast to 12% in India, which remains the largest among the SAARC countries. A number of gender disaggregated data on oncology workforce have been published from India in international journals, where domestic responsibilities and lack of structured fellowship and mentorship was found almost equally responsible for facing challenge in oncology workforce by women. Oncology societies around the world have separate women oncologist network like the ASTRO, ESMO, ASCO, where dedicated mentorship programs, policy advocacy centered on women, and collaborative networks connect women oncologists across borders for exchanging knowledge and professional development. Research on the women workforce regarding gender equity are carried out and published. This paper, published in Advances in Radiation Oncology, found that lack of training, gender bias, and work-life balance are the greatest impactors of gender equity across radiation oncology workforce. Research from the SMO included both male and female respondents, compared opportunities and challenges faced by the oncology workforce, and it compared between male and female respondents. And there exists a leaky pathway from trainee to women in leadership role because of fall off from the pathway. WHO 2021 report on closing the gender gap in leadership and healthcare workforce formulated a multi-layered ecological model that impact women's journey to leadership. Factors range from individual level to policy-making level. To empower women, future recommendations are workforce data collection, decentralized training, mentorship programs, policy changes, and community support for work-life integration. More collaborative research, advocacy efforts, sustainable solutions, and global partnerships are needed in the future. Thank you all for your patient hearing.